Hello and welcome to the Galeblade News. NHS England is launching a new service for people with ongoing health problems after having coronavirus. The government says tens of thousands of people have long-term symptoms after catching COVID-19. Your COVID recovery will be an online portal for people in England to access tutorials, contact healthcare workers and track their progress. The project will be rolled out in 2 phases, with the web portal launching later this month. It will only be accessible via personal login and will be available to virus patients who had to be treated in hospital, as well as to those who manage their illness at home. Later in the summer, tailored rehabilitation will also be offered to those who qualify following an assessment. Each programme will last a maximum of 12 weeks, the Department of Health and Social Care said. The service, which was developed and piloted in Leicester, will include access to mental health services, community support groups and exercise tutorials, either online or over the phone. Health Secretary Matt Hancock said the portal would give people who have survived the virus on demand access to online clinical support for problems with breathing, mental health or other complications. He added that the government was investing millions into researching long-term effects of the virus. Sir Simon Stevens, Chief Executive of NHS England, said rolling out your COVID recovery alongside expanding and strengthening community health and care services is another example of how the NHS must bring the old and the new together to create better and more convenient services for patients. The new service was announced on the date of the 72nd birthday of the NHS, which was founded on the 5th of July 1948. From my point of view, having an online presence is actually probably more important now than ever. The reason for that is obviously we're still living with the coronavirus, so you can't be doing too much about having face-to-face consultations, and obviously they're still having to work through people who are incredibly ill. Those kind of at the back end who have, they've had the worst symptoms and they've recovered from those, do need continued support by having this online. Means they can maybe have a little bit more frequent support, or can just have a little bit more of a check-in, and then if anything was to happen, they could then have a clear path of recording that should anything else deteriorate, which is a common thing to do with maybe some of the older people. Whatever you think, leave your comments down below, like the video if you enjoyed it, and don't forget to subscribe.